6 million kids are seriously overweight. I think it all starts in the home setting. I think we have to educate our society that 200,000 people here in BC are over obese, have BMIs above 35, which is really quite sad. And 55% of our population is overweight. And I think it's just because the high density calorie foods that we're eating, and the fact that we're all in internet plugged in society with computers and so forth, and we're not getting out and exercising. We're here talking about surgery, but we're really talking about changing things for the next generation, education, and trying to make sure that our kids don't have the same problems that we had. If you look at the MidBand, it's quite a soft and supple band. I have a model of it here, and I have a few more, and I think you've all touched it and felt it. It's just like a little belt, and it takes minimal dissection to put the band in, so we don't do a big posterior dissection behind the stomach to get the band in. We just basically pass an instrument that looks much smaller than the size of the pens here, and it's long and skinny, and we just are able to push that behind the stomach, the upper part of the stomach. When we start our dissection, we get out on this side, and when we're out on here and we have our little jaws, we can grasp it, then we put the band in, and we pull it around, and we lock it in place. So it's pretty simple. We just used one suture, just to take the floppy part of the fundus, and just take one stitch and put it up over top of the band. So the post-operative diet, I do tell patients that they can eat food as long as it's the size of a sugar cube, and they chew it 20 times until it's really emulsified in the mouth. That's what they have to do. But people going home with a band, or even with a bypass, they forget that. And they just a couple chews and swallow. And with band, it's a little bit safer, but most of the deaths from bands are due to probably an unrecognized perforation of the back wall of the esophagus or stomach when you're putting the band around. And then, of course, other unfortunate things like a spontaneous, because after surgery, anytime you have surgery, you're more thrombogenic, you're more likely to form blood clot. And so you could get a blood clot in your leg or your pelvic and veins, and they could go to your heart, and from your heart to your lungs, and include the flow of pulmonary embolism. When we say slip, it means the stomach herniates up underneath the band because people are retching, or for whatever reason. The band is here, this upper stomach's here, but if we talk about slippages and hernias, it's just the band itself, the stomach below, slipping up underneath. And when that happens, it makes the band, the opening, a lot tighter because there's more stomach coming through the band. And then people start to have vomiting issues, and they have pain and obstruction. So if people have a lot of vomiting issues with the band, you should do a barium swallow and just make sure that the band is in proper location and hasn't slipped.